Good afternoon, everyone. Hope everyone is fine and hoping that you had a wonderful morning today. I am here in New Hampshire where the temperature is about 40 to 50 degrees, which I'm not used to because I'm from Charlotte. But we are going to push on because I have an exciting topic today. Maybe not as exciting as some of the other ones, though, but just wanted to inform you. We'll just wait a few minutes and see until others join. Um, I know everyone is ready to vote. Hopefully, everyone is turning in an absentee ballot or has plans to go and vote in person. It's imperative. Please do not think that your vote does not count. It does count, and we're counting on you to be there to either vote in person or mail in your ballot. Don't listen to what those people are saying because, yes, it is a time for us to exercise our rights to vote. So let's get started. Let's just recap what's been going on. In the last two sessions, we discussed breast cancer screening and colon cancer screening and why it's important for us to continue to do those screenings during the COVID-19 season here. These screenings are still being done because most of the hospitals are open, and I went in there, I made a very early appointment, and I got in to do my breast cancer screening. I got in and got out because they had a different way for us to go out. So I didn't get hung up with other people who were waiting in the waiting room. And to be honest, there was no one in the waiting room. So please get those screenings done. And today we're going to discuss a topic, getting back to what we were talking about with weight management, a different type of topic in which we are going to discuss weight bias or weight discrimination. Yes, that's correct. We are going to talk about weight bias or weight discrimination. Just as you thought that it was only minority groups that had discrimination against them, there is a significant amount of discrimination against people who are overweight or carrying a little bit too much weight. So let's discuss what weight loss discrimination or weight loss bias is. They are negative attitudes and stereotypes that hinder positive relationships. Mostly, we're going to talk about healthcare professionals, but it could be anywhere, as we'll discuss briefly. And these are probably long-held attitudes and perceptions about people who are overweight or carrying too much weight. And this leads to rejection and prejudice. And the person who is experiencing it feels it. This discrimination can take the form of blatant, overt expressions or subtle sarcasm, like, you still haven't lost any weight yet. When are you going to start trying to lose weight? It can also take the form of teasing or bullying in children. And as you know, there's a lot of bullying going on, and children are kind of at the mercy of the administration in the schools to offset this. And many parents of children who are being bullied feel helpless in a lot of ways. Research has shown that weight bias or discrimination is the fourth most frequent reported type of discrimination, and it has continued to increase in the last few years. The article that I saw only registered the discrimination between 1995 to 2006. So our population is getting more and more obese, and consequently, there is probably going to be more discrimination. So let's delve into this topic just a little bit more, and let's see if we can give you some pointers on it. Discrimination because of weight, many people are not even aware of it at all. I came to know about it because of some of the research I was doing. And I found that there's evidence of weight bias in many areas of our society, not just in healthcare. For example, there's weight bias in employment. Research shows that people who are overweight or carrying too much weight get lower salaries for the same job, even though they're trained equally, and are probably have enough same experience. Educational institutions, in colleges, students may realize that every time they raise their hand, the prof doesn't even want to answer their questions. And likewise, if you're going to an educational, usually they have office hours, sometimes you get ignored. The media, in the past, has been played a very significant part in this, although I think since they want to keep their ratings the same way and people don't want to get fired, they've kind of kept that under wraps. Interpersonal relationships. People who are obese find that certain relationships are just not what they thought they were because of attitudes that have come out later on. And that goes for family and friends. And of course, healthcare facilities. As you can see, obese or overweight or patients who are carrying too much weight are faced with bias or discrimination in many areas of society. So let's turn to different types of healthcare providers who will interact with patients who are overweight or carrying too much weight. Dietitians. Now, of course, as a physician, I realize that we often send patients to dietitians, and that's because their main goal or their main training is to help people who are overweight or carrying too much weight. But let me share with you some of their attitudes. They feel that overweight people are overeaters, they're unattractive, and they have no self-control, and they're insecure. Now, if you got those kind of attitudes, wouldn't you feel insecure? Let's turn our attention to the nurses. Nurses feel, these are just surveys that they've done, nurses feel that overweight people are non-compliant, they're lazy, and unsuccessful. Additionally, they asked other questions, and one of the questions were, would you like to take care of obese patients? 31% would prefer not to take care of obese patients. Now, they gave no reason why, but because of attitudes and stigmas that these nurses probably grew up with, they've decided they don't want to treat obese patients. Another question was, how do you feel about obese patients? And 24% in this survey said they are repulsed by obese patients. Another survey question was, well, if you had to take care of them, would it be okay to touch them? 12% of the nurses said no. So as you can see, there are many stereotypes that have grown up without any proof in research or anything like that, and people are governing themselves in that realm. Now let's talk about physicians. They consider obese patients as non-compliant, lazy, lacking self-control, unintelligent, and dishonest. Now, not to mention that there are quite a few people who are not obese that have those same characteristics. Why they think these type of characteristics only are part of an obese person's character is very intriguing and very unfortunate. In a survey of several of these obese women, it was found that doctors kind of ranked very high in making them feel uncomfortable about their weight, and they show significant bias and discrimination about people who are overweight or carrying too much weight. And in this survey, as people were thinking about how significant or how often this happened, they recognized that 52% of the doctors that they came in contact with showed bias, or they were discriminatory, or they made them feel uncomfortable about their weight. Patient reactions to this. Patients often felt disrespected, and they felt berated. And parents of obese children often feel like they are blamed all the time. And many of the pediatricians they interact with, or family physicians, kind of dismiss them, the parents trying to explain what's really happening or the dynamics in their family. And the pediatricians or family physicians are just dismissing them, not even really listening to what they're saying. So with all these negative attitudes, do you think healthcare would be effective? The answer is yes. When it comes to interacting with obese patients, it has been shown that doctors spend less time in the visit. That means they're rushing through the visit, and they spend less time discussing their care. So there may be questions that the overweight patient wants to discuss, but they kind of just leave them. They don't even engage them in a conversation. And they're more likely to assign negative connotations to their weight. There was one, testimony in some of the information that I was researching that showed that there was a person who had a weight problem. And the person consistently, "Hi, Pam, good to see you today," who showed that every time this person brought up the weight, she was dismissed by her physician. And this person went to another doctor and found out the reason for her weight loss, or her overweightness, was related to her thyroid that was barely functioning. And all this time, her doctor was blaming all this on her, when in actuality, it was a metabolic problem. So doctors can make up symptoms about certain things. Also, there's a reluctance to perform certain screenings. And what comes to mind are pap smears. I know, for example, that there are times when there may be someone who doesn't use a medium speculum when we're doing our pap smears. But our office, to accommodate our patients, often had large metal ones or wide metal ones so that we could do the pap smears for everyone. And I was just kind of shocked that, some doctors said they just couldn't do certain procedures because they didn't have the equipment, when in actuality, it's very easy to get the equipment. And the other thing is, if something is to happen, say if they get a cancer, a diagnosis, they're less likely to intervene or encourage the patient or kind of give them the lay of the land as to what to expect. Now, how does this affect patients? Patients know when you're not treating them right. Okay, let me repeat that. Patients know when you're not treating them right. They know if you feel uncomfortable with them. I've had patients tell me that they were in a room with the doctor and the doctor was in the corner over there. The exam room was in the table over here, and the doctor never came any closer than where he was in the corner. So patients pick up on that. A lot of times, since they pick up on that, they don't come in to get their screenings, like their mammograms, their pap smears, and colon cancer screening, like we talked about 2 weeks ago. And they're more likely to cancel appointments. Now, it may be easy in some places to reschedule an appointment, but in a lot of places, those appointments are booked out, especially in GYN offices, sometimes 2 and 3 months ahead. And so if you rebook it and keep rebooking it, by the end of the year, you're just not going to have an appointment. and they delay their appointments. They may not even come because of how they feel when they're in this appointment setting. So let's answer this question. Does bias affect the quality of care to the overweight or person who has too much weight? Does it affect the quality of their care? So I'm going to turn your attention to a survey that just tested women and wanted to find out why they just did not come in for their appointments. They felt disrespected by their doctors or other people in the office, because sometimes it's not the doctor, it could be someone else in the office who continually says derogatory comments. Many of them did not want to be weighed. So I suspect that the weighing machine was out in full blast, and or the MA or nurse that brought them in just had to say the weight out loud. Negative attitudes by their doctors or the nurse practitioners or the PAs, and unsolicited advice on weight loss. Oh, you just haven't lost any weight yet. When are you going to get around to it? And in best practices, physicians, nurse practitioners, and physician's assistants are supposed to ask permission, such as, can we talk? Would you give me permission to talk with you about your weight? This statement is less threatening, and it is, the person can say yes or no, and that's a way of deciding if this is the right time to discuss this with the patient. And the patient will feel a little bit more comfortable and not be as feeling that they're not respected and they don't have a voice. And really what a lot of this discrimination is really kind of silencing them because they feel like they're not empowered to do anything. So how does this play out in obese patients or patients who are a little bit more overweight? They feel vulnerable. Some of them feel depressed, sometimes have anxiety, and sometimes in the lower age groups, like as teenagers or children, they have low self-esteem and poor body image. And some may have thoughts of suicide or maybe even think about it, but I imagine there may be other reasons for that. So what are the consequences of patients who are obese or over carrying too much weight? How does their health get affected? Because they're avoiding coming in to see the doctor, they're avoiding getting their screenings for cancer and maybe immunizations also. And so what we have found is, and the research bears this out, that there are increased risk for mortality and morbidity. And let's cut away from those big words, but let's just say some of the things that they are high risk for. They're at higher risk for prediabetes and diabetes. And if you don't come in and get your screenings or anything, you may inadvertently get on to diabetes because you never got screened for prediabetes because you haven't been coming in. Additionally, patients who carry too much weight are at high risk for hypertension. And we know that the diabetes, the hypertension, a lot of times they will also have high cholesterol levels. And if no intervention is done for weight management, many patients will go on to develop heart disease and the potential for strokes or heart attacks. People who are obese or carry too much weight are also at high risk for colon cancer, as we discussed a few weeks ago. And they're at high risk for breast cancer also. And another condition called sleep apnea. Many people who carry too much weight are at high risk for sleep apnea. And sleep apnea is when you have somebody that snores all the time. They could be snoring every day or snoring occasionally. And they may not be aware that that is a condition that needs to be evaluated. And sleep apnea, can have some detrimental effects on health also. And what makes it even worse is the fact that people who have they're overweight or carrying too much weight may have multiple types of disorders. So they're carrying the extra weight, plus they're carrying a higher burden of chronic illnesses also. So that leads them to have a low quality of life, and many of them kind of give up. I once had a patient who was very, very, very obese. Our literature shows that saying morbid obesity, which is what it used to be called, should not be said any longer, but just carrying too much weight. This patient had diabetes, and she had some snoring, and she had some upper respiratory issues, and she really couldn't walk. She had so much weight on her. I forget what her weight was, but she had health issues that put her in and out of the hospital. And when I asked her, why aren't you taking your medicines? She said, well, I can't afford them. I said, okay, well, we'll make arrangements for you to get the medicine. Our office was situated so that we could get this medication for her. And somehow she was also followed up. I hadn't seen her in a while. She showed up again. And this time her conditions were worse. And I said, well, look, we'll get the medications for you. She said, Dr. Watts, it doesn't make any difference. I just don't feel that anything's going to make a difference. I said, well, we can get some help for you, but she didn't want to hear about it. And she did have a specialist by then, for she had some lung disease. I think she had asthma or COPD. And she died prematurely at age 40 as a result of her massive obesity and her chronic health conditions that were there. And I didn't find out until I got the death certificate, which I found to be very unfortunate. But many people suffer needlessly because of some of these biases that are prevalent in our society. And so we as physicians and healthcare providers, such as nurse practitioners and physician's assistants, have some work to do on ourselves, because needlessly, patients are suffering because of our attitudes towards them, and unseen attitudes, or the way we hold our bodies, or what we say. So recommendations for patients. My recommendation for patients, if you want to find another healthcare professional because you're not satisfied, is to ask family and friends about their experiences with their healthcare physicians, nurse practitioners, or PAs. Know when you're supposed to get your routine screenings. We discussed all that last time. Mammograms are probably age 40. Colon cancer screening, probably age 50, but these are only for healthy people. There are different times for people who have had, breast cancer in their family or colon cancer in their family. And make sure you know when to get your pap smears also. In many places now, hello Elaine, how are you? Glad you could come on. In many places now, you can report these derogatory comments to the manager of the clinic, especially if it's one of these hospital-based clinics. And in some places, these comments or these letters get to the CEO's office. So many hospital-based clinics want to have ratings. Like if you go online and look at where your doctor is, they want to have 5 stars across the board, no matter who it is. And if there's a 3 or a 4, they're going to really do something about it. I was working at one hospital. No, I was visiting someone at one hospital, and there was a little board there, and it gave the patients, it empowered the patients about what they were experiencing in the hospital. And they could write on there what they felt was going right about their care there, and they could mention the names of the people. And for people who felt they weren't getting the care that they needed, there was a phone number for them to call, and they had a chance to air their grievances. So I would say use those remedies that are available to you if you feel that you've been treated, mistreated, berated, or disrespected in a healthcare environment. And the other thing I would like to recommend is if it's time for you, if you are overweight or you're carrying too much weight and your doctor has mentioned this to you many times and you're feeling anxious, it is time for you to have this appointment and you just feel like you just can't go. This is time for you to sit back and figure out why you're feeling that way. Was it the last appointment? Was something said that was off color, something you didn't appreciate? Sit down and figure out what it is and make your own arrangements to find another person to help you with your healthcare journey. Because we're supposed to be helping people, not hindering people. And you heard all the diseases that I talked about. A lot of those can be prevented if we're able to intervene and help our patients lose the weight that they need to lose in a timely fashion with compassion, with empathy, and with understanding of the fact that it takes a while to do that. And the last part is for physicians. We do need to do our homework, and we need to understand that old, outdated ideas of how people are and how they respond, we need to reevaluate that ourselves. And I'm happy to see that in some of our conferences, we are delving into bias. I haven't seen them talk about weight bias, but they're talking about bias per se among minority patients and how they can overcome that. So I would like to answer any questions at this time. This was just, the amount of information on this was so much, I had to kind of pare it down because it can get unwieldy, but pretty much some of the research that I saw is pretty much similar research that had gone on years before, but there hasn't been a call for for doctors and other care providers to do something about it. Listen to what the patients are saying, understand that everybody that has a lot of weight on them, it may not be anything they can control right now. It may be the fact that they can't get certain foods and that the patient is not to blame for that. Could they have bad habits? Yes. Who doesn't? But do not blame the patient, because many times, I can't tell you how many times patients have come to me and I'll say, well, how can I help you today? And they'll say, I need to do something about my weight. I didn't even have to say anything. Many people know they have to do something about their weight. So we as clinicians need to set the stage and set the tone so people feel comfortable talking to us about their weight and how to be successful in their weight loss journeys. So I'm going to open it up for questions now. If anyone has questions or comments, the floor is open. And some people may not have come in at the very beginning, but the topic that we were discussing today was discrimination or bias for people who are overweight or carrying too much weight, and how it affects healthcare outcomes and how people feel when they go to certain doctor's offices. Many feel that they're not really being heard or they're being ignored. And it can take many forms. It can take many forms. So please, if you have any questions, just put them in the chat and we will go over them now. No? Okay, well, thank you, everyone. But let me just remind you who I am. I am Dr. Hope Watts, board-certified family physician, health coach, speaker, and lifestyle expert. I help mid-career women reach their best selves. I help women find the right foods and the right fitness levels so that they can have the energy and the lifestyle they've always wanted. So please like me on Facebook, and you can find me on Instagram, Twitter, and LinkedIn. Oh, I have a question here. It says, what good foods can I eat to keep me full? That's a loaded question because um, sometimes people don't eat enough protein. That's what I found. And protein helps keep you going for a longer period of time. And like for me, I have to say, for me, I have to have some type of protein with each meal to keep me going because I kind of eat food and it seems like it's already gone. Hi, Dr. Hi, Dr. Bobby. Thank you for coming. So usually you have to have a certain amount of protein in your meals, and the recommendation is 2 to 3 ounces of protein for women. And oh, as a diabetic, okay, yeah, protein does not interfere with your diabetes at all. That protein such as chicken, fish, um, what else, turkey, pork, those foods will not interfere with your diabetic levels or your blood sugar levels. The foods that will are the starches, such as potatoes, um, rice, beans, not as much. It depends on how much you eat. Uh, sweet potatoes aren't too bad, but regular potatoes, um, and like snack foods, cakes, cookies, candies, chips will do it. And so you need to avoid those also. Did that answer your question, Pam? Okay, I don't know whether she's still on the line or not, but hopefully that answers your question. But we can talk offline if you have some other questions. So, Dr. Bobby, I was just reviewing what we talked about today. We were talking about weight discrimination and bias. Um, we had talked about in the last few sessions about cancer screenings and how people who are experiencing weight bias or discrimination often do not come in for their screenings, and they often move on to more chronic illnesses as a result of feeling berated, disrespected. And so they let a lot of their cancer screenings go and they don't come in for their physicals either. And we just mentioned some of the diseases that people who are overweight or carrying too much weight can come into, and diabetes, hypertension, higher risk for heart disease and stroke, sleep apnea. And we just mentioned some of those to just to bring home the point that people who are obese and overweight need to be seen and feel comfortable in a physician's office or another provider's office, and not to say disparaging remarks or just dismissing them, because some physicians will do that and not entertain any of their questions at all. So, Pam, we'll talk afterwards if you have any other questions. And if there are no other questions, we will end this session. And it sounds like we may need to bring it up again. We may discuss it at a later date. I kind of streamlined the information because there's a lot of information out there, a lot of research out there, and it looks like weight discrimination is like the fourth very significant discrimination that people complain about the most. So we will bring this to an end unless there are some other questions. Okay, I don't see any other questions here. Okay. So, as I said, I'm Dr. Hope Watts, board certified family physician, health coach, speaker, and lifestyle expert. I help mid-career women be their best selves. I do that by finding the right foods and the right fitness levels so that they can have the energy and the lifestyle they've always wanted. Please follow me on Facebook, Instagram, Twitter, and LinkedIn. Thank you, everyone. Hope you have a wonderful day. It's chilly where I am in New Hampshire, so hopefully your weather is not that bad. I know there may be still some rain from this last hurricane. So take care, everyone. Until next week. Have a wonderful week.